Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us for our weekly press conference on Delaware's response to COVID-19. I'm joined again by Dr. Carol Rattay, who's the Director of the Division of Public Health, and by Pam, our sign language expert for the deaf and hard of hearing. Thanks for joining us again. I know we have media have joined us, and those of you who have followed us on a weekly basis, we appreciate you being here today, February 1st. The start of the Lunar New Year. It's also the start of the sale of surf fishing plates by Denrec. And so if you're interested in that, I know I'm sure they've gotten a real rush of that. And sadly, it's also the 5th anniversary of the murder of Lieutenant Stephen Floyd, correctional officer at the James T. Vaughn Correctional Facility in Smyrna. And our thoughts and prayers go out to his family and friends and to correctional officers. Reminder of those first responders that risk their lives every day for us, and law enforcement and fire services, emergency services. And our thanks go out to all those teams for the response to the snowstorm over the weekend. Significantly more snow in the lower part of our state, in eastern Sussex, central Sussex, across Sussex County, I think, from as little as maybe 6 inches to over a foot of snow across Sussex County. Similar amounts, but less in Kent County, and not a lot up in Newcastle County. So thanks to DelDOT. Those folks on their plows were out there early. They were ready to go as the storms started overnight. Our folks at the DEMA, Delaware Emergency Management Agency, AJ Shaw is not with us today, as he normally is, for the press conference. His teams did a great job. And then, of course, on the job again, our Delaware National Guard, thanks to General Berry and his team, coming up once again, as they have for just about every problem that we've had from the Hurricane Ida. Their response there in the city of Wilmington in particular was critical. Obviously, what they've been doing in COVID response and testings and vaccination. Now we even have guardsmen and women have been trained up to be CNAs in our long-term care facilities, helping to decompress the number of folks in our hospitals. We have probably 70 or so National Guards men and women. We have some photographs there to show their work that they're doing in the hospitals and non-clinical roles. Really just been a welcome addition to our hospitals, which over the last several weeks since the New Year's surge in positive cases and hospitalizations have been really under the gun, as staff tested positive and couldn't come to work. More people over their capacity in all the hospitals up and down our state, and our National Guard came up big in every case. Was with our governors from other states across the country this past weekend. Lots of conversations about the situation in each of their states. It seems like all states have hit this winter peak and are on the downside of the curve. We'll see that in a minute as we look at our case rates, our percent positivity, and importantly, our hospitalization rates. And a lot of focus among the governors on looking forward. What are we going to do? How are we going to manage COVID-19 going forward? Every governor, regardless of party, really focused on keeping children in school safely. We know how important that is for the children, for the families, for our economy. States across the country, across the region, and across the country, with our economies accelerating again. A lot of discussion about federal funds that are flowing into states to supercharge the construction industry and other sectors of our economy, support our hospitals and healthcare facilities and the workers in those facilities, to support our emergency preparedness and response personnel. Great help from FEMA with our testing site over at the DMV in Delaware City. We'll talk a little bit about that. But let's go right to the data. We've been looking at this now over the last couple weeks, and it's in a positive direction again. It gotten very negative. You look at the new positive cases on a 7-day moving average, that was well over 3,000 just a couple weeks ago. Now under 1,000 per day on a 7-day moving average. Still a very high number relative to better days under COVID-19. but certainly headed in the right direction. At the same time, we were testing the first 2 weeks of the month. We were testing over 60,000 a week compared to the 80,000 a month that CDC had recommended we'd have to do back at the beginning of the COVID. Those percent positives were over 30%. 1 in 3 cases were coming up positive just a couple of weeks ago. Now we're under 20%, continue to improve there. Most importantly, the Delawareans that are in the hospital, either with or for COVID, under or right there at 400, down from 759 at the peak on January the 12th. We'll see that roller coaster ride in a minute. And compared to 474 hospitalized a year ago on the 12th of January, again, the same, coincidentally, the same date of the peak last year, January 12th, peaking this year at 759, down to 400 with 39 critical hospitalization. It's important to point out one of the things that we're seeing that's different, we think, than it was last year, and every other state was talking about the same thing, is you have people that are in the hospital for a COVID treatment because that's the reason they are admitted to the hospital, and then people are admitted for something else, and then they're test positive, and so they are tested with COVID-19. In either case, they're still in the hospital, and they still stress hospital services, and they still need the National Guard men and women that we've deployed there in the non-clinical role, and in our effort to move those positive cases out of the hospital into less acute situations. So here's the roller coaster ride, the hospitalizations. You can see the peak last January 12th of 474, the peak just a couple weeks ago here, and this year at 759, down to 400 yesterday, and we're looking to continue that drop and make decisions accordingly based on that. Notwithstanding the reduction in those that are in the hospital with or for COVID, you can see still the very high census over capacity that each of the hospitals are experiencing statewide. So that's the gray graph, the gray area in the graph, and the dark blue are those that are in the hospital with or for COVID treatment. And you can see where that number is going down. The total population is about the same, down a little bit statewide. So we need to see some improvement there. Hopefully we will, as those COVID positive cases get moved out and released, discharged into long-term care facilities. We continue to focus, and people, the most important thing people can do to address COVID-19 and to help us with the hospital situation is to get vaccinated. 66% of Delawareans are fully vaccinated. We've administered over 1.6 million vaccinations. That's an incredible number when you think about it. Been doing it just over a year, and 70% of Delawareans fully vaccinated over 5 years of age. Of course, those that are eligible. 75% 12 years and older, 76% 18 and older, and then as you get into my age group, 65 and older, largely vaccinated, fully vaccinated, 94%. And we struggle a little bit on boosting, and Dr. Rattay is going to talk about that. It's really, really important. If you look at the numbers, those folks that are fully vaccinated with the two vaccines that they've received need to get that booster shot. We don't have as many as we need, as it would be protective. So there you can see the numbers there. Fully 44% are fully vaccinated, 18 and older, 56% 50 and older with received a booster, and 64% 65 and older. So we need to get more Delawareans boosted, and we know we can affect that hospital number. We know that we can affect the spread of COVID in our communities, and we know we're going to have to going forward as we fully engage the economy. Most things are opened up pretty fully. I know people are a little hesitant to go back indoors where there's going to be big crowds and maybe not a lot of mask wearing, but we certainly need to make sure folks get their full vaccinations and then get their booster shot. Thanks again to FEMA for their response with our drive-through testing site at the Delaware City DMV. It was quite a success. We tested nearly 2,500 individuals at a time where testing was scarce because we were testing over 60,000 a week, which far exceeded what we expected to do in our capacity there. So we had, it's going to close a little bit early. It closed Thursday, January 27th, due to the winter storm. We closed it down there because the next couple of days we had the storm. So that was a big help on the testing front. We still have the indoor mask requirement. We continue to evaluate the conditions that gave rise to it, but masks are required in indoor public settings, in your supermarkets, convenience stores, gyms, restaurants. I see really good compliance, and thanks to everyone who's following the indoor mask mandate. We still require masks, of course, in schools. That's our number one priority, to keep children in schools. And some of the districts have had challenges keeping schools open, mostly because educators and staff who've tested positive. Operationally, it's tough to run a building without enough staff and without school bus drivers to bring the children to schools. Again, here's some photographs of our National Guards men and women in the hospitals, working in non-clinical positions, really providing tremendous support to our frontline healthcare workers there in the hospitals. Really welcomed in each of the facilities with open arms. Great for morale. Really have lifted folks up in our hospitals and come up big. We also have them trained up to work in long-term care facilities to help decompress the hospitals. We're seeing those numbers go down anyway, and they should go down even further. Remember, the vaccine and boosters are effective against COVID-19, particularly against serious disease and hospitalizations, but you really need to get that extra support, extra protection, getting your booster shot. Dr. Rattay is going to talk a little bit more about boosters and give you some more on the science. We appreciate the compliance with the indoor mask mandate. It's really made a difference over the last couple of weeks, and we're getting better in every indicator for the spread of COVID in our community right now. Dr. Rattay.
Great, thank you so much, Governor. So I know we've been discussing over the past couple of weeks that getting the booster vaccine is important, but in the past week, a number of additional studies have been produced that really put a spotlight on how effective they are. So we're going to spend some time today talking about some of these new booster studies and again, as you said, Governor, why it's so important. Let me start first, though, with sharing some survey data from the Kaiser Family Foundation from a survey done in December. Now, not surprisingly, in the face of spreading the Omicron variant, 50% of the public said they were worried they would get seriously sick from COVID-19, and that was up from 30% in November. Interestingly, this concern was greater among minority populations. So 64% of Hispanics and 64% of Black individuals said they were concerned, compared to 43% of white adults. So as the governor just said, we know that getting vaccinated and boosted is a key way to reduce the chance for getting sick. But our booster rates are not where we need them to be. Delaware ranks 26th among all states in overall booster uptake. We know that we can do better, so we're trying to understand the reasons why booster rates are low here and nationally. So on this next slide, I wanted to highlight some additional insights that came from the Kaiser Family Foundation survey, where they identified confusion around booster recommendations among Americans in December. So 23% of adults, including 21% of vaccinated persons, reported being unsure as to whether or not it was recommended that all adults get a booster, or they incorrectly said CDC's not recommending a booster for their age group. And again, we saw disparities. They saw disparities in these data. So this confusion or uncertainty was greater among racial and ethnic groups, as well as younger adults. So 31% of Hispanic, 28% of Black, and 39% of younger adults between the ages of 18 to 29 reported being unaware of CDC's booster recommendations. Digging into this more deeply in a Northeast state, they found that the booster uptake was impeded by people being confused about who's eligible for a booster. So we'll talk about that in a little bit more detail today. Misunderstanding about the effectiveness of boosters against Omicron, which we'll talk a lot about today, but also confusion about timing after past infections. So we'll touch on that as well. So let me dig into some recent data that I mentioned around the effectiveness of boosters, especially against Omicron. And then we'll talk about eligibility. A quick reminder of why boosters are needed. Pfizer and Moderna have continuously monitored the effectiveness of their vaccines. And their follow-up studies with vaccinated individuals showed a reduction in vaccine effectiveness after approximately 5 months after people completed their initial 2-dose series of the vaccine. So this isn't new data. We've talked about this before. But then they studied the impact of the 3rd dose of vaccine, a full single dose for Pfizer and a half single dose for Moderna. And what they found was that the booster didn't merely return a person's immune response to the previous levels of the primary series, but it actually increased them to exceed previous levels. So if the initial effectiveness of a 2-dose series of Pfizer is 90%, getting a booster 5 months later takes it up to as much as 100%. So not only does it compensate for the reduction in vaccine effectiveness, but it also improves the immune response beyond original levels. So let's talk about another study where 2 weeks ago, I shared this study that indicated that Moderna's booster elevated antibodies against the Omicron variant 37 times above the response from just completing the primary series. And for Pfizer, that booster increased the antibody response by 25 times over the primary series. And this is backed up by several new studies which highlight the effectiveness against cases, symptomatic cases, hospitalization, and death from COVID. And that includes its effectiveness against Omicron, which of course is the predominant strain by far that's circulating now. So let's look at the next slide, which is a study that was published in the Journal of American Medical Association, or JAMA, just about 2 weeks ago. And it detailed a study of over 23,000 symptomatic people who tested positive between December 10th and January 1st. And the study shows that those who were boosted were much less likely to have tested positive than even those who had just received the 2 doses. You can see from the slide that the percentage of those positive was low if a person received a booster, even if the person was positive for Omicron. So this highlights how effective getting boosted is against symptomatic infection. Again, even if the COVID strain is Omicron. A second study that was recently released, which came from CDC, looked at cases and deaths among unvaccinated and vaccinated adults from April to December 2021. So this is on the next slide. And so, of course, this study began when Delta was became the dominant variant, but also was ending as Omicron was emerging. And what they found was that people who were unvaccinated against COVID-19 as the Omicron variant emerged in December had nearly 3 times risk of higher infection than adults fully vaccinated against COVID-19, and 5 times a higher risk when compared to people who had received a booster. So again, you're seeing how the booster as Omicron emerged, was really effective in preventing just getting the COVID-19 Omicron strain. On the next slide, from the same study, I wanted to highlight some other findings. Protection against infection, hospitalization, and death during that Delta predominant period, but also against infection during Omicron emergence. And what they found was that protection was much higher among booster vaccine dose recipients, especially among older individuals, so those aged 50 to 64 and those aged 64 and older. The COVID-19 boosters provided significant protection against COVID hospitalization in these older age groups, even when the Omicron variant became predominant. So 44 times you're more likely to be hospitalized if you're unvaccinated compared to those who have a booster. That's a huge, huge difference. On the next slide, wanted to highlight two CDC studies. The first looked at over 200,000 emergency department and urgent care visits and hospitalizations from August 26th to January 5th, which showed that a third dose of Pfizer or Moderna reduces the chance of needing a visit to the emergency department and hospitalization by 94% compared to unvaccinated people, and reduces the chance of an urgent care clinic by 82%. Now, these data cover a period of 3 weeks when Omicron was the predominant variant. The second study looked at hospitalized adults during the same time frame and showed that getting a booster versus just having 2 doses increased vaccine effectiveness against hospitalization among adults in individuals who didn't have immunocompromising conditions from 82 to 97%. And importantly, for those who are immunocompromised, it increased the effectiveness from 69 to 88%. That's really important because the studies had previously shown that the people who are immunocompromised did not have a very strong response to the COVID vaccine, but going from 69% to 88% with the booster is a huge difference, even for those immunocompromised. Just about an hour ago, as the CDC released yet another study looking at individuals 18 years and older, and it showed that hospitalization rates among unvaccinated people were 23 times higher in comparison to people who had a booster. And also this newly released study showed that people with a booster were much less likely to have an ICU admission or to require being put on a ventilator. So again, lots of important reasons to be vaccinated, up to date with your vaccine, which means having a booster. So let's talk a little bit about what we have seen recently here in Delaware. Between January 7th and the 23rd, we took a look at how many were up to date versus not up to date among our cases. 86% of our cases were not up to date with vaccinations. 88% of our hospitalizations were not up to date with their vaccination, and 83% of our deaths were not up to date with our vaccination. And what that means is, although we know that being fully vaccinated can be protective, people who are unvaccinated, partially vaccinated, or fully vaccinated are just not as protected as those who have received your booster. And our own data are showing this. So on the next slide, who's eligible for the booster? Hopefully the data has made it super clear to you that the boosters are effective and extremely important for preventing infections, but more importantly, hospitalizations and deaths. But let's move to who's eligible, and hopefully we can clear up some confusion around who's eligible. So really all Delawareans 12 and older are eligible for a booster if it has been a certain period of time since their primary series. So if you're 12 and older and you receive Pfizer as your primary series, and it's been 5 months since you got your second dose, you should get your booster as soon as possible. If you receive Moderna as your primary series and you are 5 months past your second dose of Moderna, you should get a booster as soon as possible. And if you receive J&J as your primary vaccine, and it's been 2 months since you received your J&J, you are eligible for your booster and you should get it as soon as possible. Now, for those who are 18 and older, you can choose any one of the vaccines. If you're under 18, 12 to 17 are those who are authorized for boosters now. Pfizer is your only option for a booster at this point. Here's one of the points where we've seen a lot of confusion. If you have had COVID, the infection, which we know many people were infected in the last 4 to 6 weeks, as long as you are no longer in quarantine or isolation, you can and should get any vaccine that you're eligible for, whether it's your first, your second, or your booster dose. So if you got COVID and it's been 10 days since you got COVID and you don't have symptoms or a fever, you should get your whether it's your booster, your first dose, your second dose as soon as possible. Don't wait any longer than you need to get up to date with your vaccine. Where can you get it? You can really get it anywhere that you find the primary series of the vaccine. At our DPH standing vaccine sites that are listed here or our DPH clinics, you don't need an appointment at either location, but also our pharmacies have been a great place for people to get their boosters. Many primary care providers are administering the vaccine, as well as federally qualified health centers. So finally, there's some additional technology to help with this. You can, of course, visit de.gov/getmyvaccine or vaccines.gov for a location near you. But if you don't have a computer, you can text "get vax" or in Spanish "vacuna" and get 3 vaccine sites near you on your phone in just minutes. And so with that, back to you, Governor.
Thank you very much, Dr. Rattay. Great information there. It's so important that everybody get vaccinated first, both doses, and then get your booster shot. If we all can do that, we'll get to a better place as a community. Fewer people that'll test positive, come down with a positive test, fewer people that will be admitted to the hospital, fewer people that will pass, sadly, with COVID-19. The numbers there, they speak for themselves. It's been documented in other states, and clearly it's the most important thing that we can do. If you still are having some hesitancy there, make sure you contact our folks at Public Health, talk to your primary care physician, look at the science and follow the science. I just want to conclude before we open it up to the media with another thanks for their National Guard men and women who are deployed in non-clinical roles at our hospitals. Really helped us over the last couple of weeks to decompress the hospitals, to provide support when the hospital staff were out testing positive for COVID themselves, were out because they were exhausted from the number of shifts that they've been running. Just a really great effort by our men and women of the Guard. We've also deployed them to the long-term care facilities so that they can help decompress and discharge patients from the hospitals where they don't need the kind of hospital care that they're going. So our thanks go out to the Guard once again. We appreciate their service. And we thank Dr. Rattay for all that information about boosters. Encourage all of you to get boosted as well. And so we'll open it up to the media for questions. I don't know that we had a lot today, but we're willing to take whatever questions that you have.
All right, Governor, the first question is going to come from Meredith Newman from the News Journal.
Hi there, I have a couple questions. First for Dr. Rattay, can you say if we're past the peak of this current surge, or is the concept of peaks irrelevant as we're in this pandemic for almost 2 years now?
Hi, Meredith. So as we've seen over and over again with COVID, there's certainly some unpredictability. But in public health, we look at peaks all the time. Influenza is, the one that we're always looking at every year. And certainly, when you look at the data right now, our case data, our percent positivity, our hospitalizations. And also on our website, we have something we called COVID-like illness, which is a really helpful indicator for us. All of those indicators show that we are on the other side of this Omicron peak now. In other words, we are headed down in a good way, and it seems to be decreasing rapidly. So certainly we are pleased to see these data.
And Governor, in terms of the FEMA site closing early, was it closing early because of weather or demand? And if it was demand, is that a result of missing the window around the holidays when demand for testing was insane?
Yeah, I think it was a combination, Meredith, but clearly we missed the initial surge. We, took a week or so to get it up. It was very helpful, obviously, and we appreciate it. It took us, when you make a request to FEMA, to the federal agencies, it takes them a while to process it and then get it set up. And in the meantime, we had that surge in testing. There was still a very high demand when they started out there. And then, of course, it ran its course pretty quickly. The good news is, apropos your conversation with Dr. Rattay, we're seeing that peak on January 12th. You think about it, it's a couple of weeks ago. And then once on the downside of that, everything started to get better in line, number of positive cases, percent positive, number going to the hospitalizations, admissions for COVID. We've have this, this question around hospitalized with or for COVID. And it's something that the other governors have reflected on. Regardless, with or for, that they're in the hospital. And so it puts pressure on the hospitals and requires a different kind of response, a response that is geared more towards helping them with decompression, helping them with staffing that's not available. So with respect to testing, it's looking forward, you always want to be a little bit ahead of it, but it's hard to be ahead of it ahead of the curve, that is, because it kind of sneaks up on you at times.
And just to follow up with one more point, I know I had to cancel for snow, which makes sense, but why not keep it open this week when it was supposed to end? I think it was the 7th, since it was federal resources and it wasn't putting a strain on any state resources.
Yeah, I think simply because the demand wasn't there. Obviously,
Okay.
The snowstorm kind of, going to set the table. That combined with the reduced demand, just felt like, those resources could be better deployed somewhere else.
Great, thank you.
Thank you.
Our next question will come from Katie Tabling at the Delaware Business Times.
Yes, hello, good afternoon. Governor, about you, the slideshow pointed out that roughly 2,400 tests at the DMV site were completed. As of January 18th, it was mentioned that Delaware was testing 8,000 people per day. I'm not sure where we are testing per day. You haven't mentioned that in your slideshow. The response time for test results, PCR tests, is an average of 3, 4, 5 days a week. Before Christmas, it was 12 hours. I'm just wondering, what is the state's plan or strategies on how to expedite the testing process so Delawareans can get results faster? Because part of what this surge is, if we are using that term or not, was kind of triggered because people didn't have the answers in time. So I'm just wondering, does the state have any sort of strategy on how to address this moving forward?
Yeah, so fortunately, we're on the other side of the peak, God willing, and on the downside, both in terms of the demand for testing and i.e. the availability. If the question is, whether we could have done a better job anticipating this peak and had greater supply. The supply was limited across the country, both in terms of PCR tests, which are the ones that aren't immediate. Our target is to get a test return by within 24 hours. And so you've got to be, and that the limitation there is the labs. And so if you have more tests, you're doing more tests, all you're going to do with limited lab capacity is stretch out the turnaround time for your results. And so part of that is we can control, and part of it we can't control in terms of the lab testing results. One of the helpful solutions to that is to have more availability of the rapid test, right? The antigen test, if you will. And there was a shortage nationally in those tests because then you can get your answer back in a matter of minutes. It's not as accurate, and sometimes you have to retest with PCR, but you can get a better handle on whether you're positive or not. And when you have the kind of spread that we did, the assumption is that you're positive. And with that, I'm going to turn it over to Dr. Rattay for any additional comments. But the point there is that we are limited by the lab that processes the test in addition to the number of tests that we actually have.
Yeah, that's exactly right. And it's not surprising our testing numbers have gone down. I know AJ's not with us today, so he would have shared that it was approximately 46,000 tests that were completed last week, which is certainly down from the 60,000. In our state, we do have the capacity for that. The turnaround time for our PCR specimen is less than 24 hours at this point. Certainly to get a little bit higher than that during the high demand. But I think we're happy with the capacity that we have right now. But as the governor said, we really do support more people having access to the rapid tests so they can get tested right when they need to, whether they have symptoms or have been exposed or, trying to get out of quarantine, to know that they're safe to be out of quarantine. Certainly that's an area that we're working closely on with AJ.
And one of the factors there is the limited number of authorized manufacturer of those tests. And it came up within the meeting of the governors that encouraging the FDA through our contacts at the White House task force to increase the FDA approval for companies to manufacture and deliver those tests. Right now, it's a limited number, and therefore they have limited capacity.
Thank you for answering that. My last question comes from our Legislative Affairs office here at Delaware Business Times. Governor, has your stance on marijuana legalization changed at this point since there is a new bill progressing through the General Assembly?
It has not changed.
Okay. Thank you very much.
Mm-hmm.
All right, our next question is going to come from DJ from WDEL.
Hi, with the Supreme Court's decision that government-ordered vaccine mandates, the power for those lies within the state. I was wondering if that was something that you would consider.
It's not something that we've talked about recently. My own view, particularly for certain populations, was to wait until there was a full authorization, FDA authorization, as opposed to an emergency authorization. It is something that's worth looking at, particularly in certain circumstances and certain populations, healthcare workers and long-term care facilities. It is, you have to be careful in terms of having unintended consequences of limiting your workforce, that type of thing. It's not something that we've focused on recently.
With the dismissal of some faculty from Christiana Care, is it something you would retroactively look at to maybe protect them against possible, with the Supreme Court saying it lies with the state, maybe from workers coming back and saying I was wrongfully dismissed?
Yeah, I'm not a lawyer. It's not something that we've thought about now.
Thank you.
All right, we have one pre-submitted question from Cody Decker at WRDE. Cody says there are some hospitals in the region who are starting to have limited visitors come in. With the numbers the way they are, is it safe to say we are out of crisis mode in hospitals, or are there still too many hospitalizations to say that?
Well, first of all, I would say those determinations ought to be made by the hospitals. They know the conditions within their facilities. We communicate with them and have been on a weekly basis to better understand what they're experiencing there. But if you look at the slide, and I'll ask if the slide of the total census in our hospitals can be put back up, you can see that even with the significant decline in COVID-19 patients, the hospitals are still over capacity. That's the gray area and the gray, the combination of the gray and the dark blue. And so even if you look at the numbers, they're going to be over capacity at a level that could be problematic for them. They tell us whether it's problematic. Obviously, they've gone into a situation where they're using emergency standards of care. We've heard that. We listen to them. It's really a decision that they will be making. I would just say that the numbers demonstrate that they're still over 100% capacity there with this graph that we're looking at. We will talk to them later this week, I believe, and get an up-to-date report on the conditions both in their emergency rooms among COVID patients and in the hospitals more generally. I do know that we have our National Guard men and women that have been deployed and welcomed with open arms into the hospitals to help with non-clinical roles, and with our National Guard men and women who've trained up to be CNAs in long-term care facilities to help decompress those populations in the hospitals. That is to have people be discharged to the long-term care facilities.
And that was our only pre-submitted question. So I think we're all set.
Very good. Well, thank you all for joining us on this February 1st, the first day of the lunar New Year. It's also the first day of Black History Month. We do have a series of events there on the state website, the Division of Historical and Cultural Affairs. Go on there and look at it. It's also the first day to get your surf fishing license. We direct you to that as well. Still have a mask mandate indoors. Stick with us for a little while longer so we can get to a better place, help our hospitals and help prevent the spread of COVID in our communities. Thanks very much for joining us.